Doctors of Reddit, what is the biggest medical mystery you've solved? Story 1. Not my story, but an ER physician, Dr. Mark Waba in Saskatchewan, who recognized that the patient's headaches were due to carbon monoxide poisoning, and because the patient lived in an apartment complex, he also made some calls and was able to save the entire building from carbon monoxide poisoning. Story 2. I made something up on the spot that saved a guy's life. Motorcycle crash. Dude comes in agitated, breathing rapidly, has the I'm dying look in his eyes. We intubate him for low oxygen levels, and it's just not working. The tube's in the right place, but now he has 2 massive pneumothoraxes, collapsed lungs, and with every breath he is pouring air out of the chest tubes I placed. Air is going in, but not making it into his lungs. There's an airway injury somewhere, and it's big. I tell my ED colleagues to get a bronchoscope ready because we're going to do the fastest CT ever and figure out what's injured. He barely survives being in the CT scanner. We get one pass through and speed him back to the ED so we can figure out the next step. As the CT images come across, it's worst-case scenario. His trachea is completely severed, and forcing air to go through has created this large air-filled gap in his neck meat between the 2 ends of his windpipe. Every breath we force in there takes the path of least resistance, meaning into the chest cavity and out the draining chest tubes, but not into his lungs. So basically he won't survive long enough for us to try and surgically fix it, but if we could just push the breathing tube down to the lower segment, we would be able to help him breathe again. So in a moment of inspiration, I tell my respiratory tech to set up the bronchoscope. I stick the scope in the breathing tube like usual and have the ED doc helping me pull the tube most of the way out. And there it was. Once the ET tube was pulled back, my bronchoscope was basically sitting in what felt like a giant cavern of neck meat, all stretched out from forcing so many breaths down the ET tube. And at the end of this cavern was the other end of his trachea. In reality, this cavern was probably 15 millimeters wide at the most, but I was locked on and drove that bronch straight down the middle and into the lower segment of his trachea. Once I had the scope and I basically rammed it as far down into his lung as it would go, and the ED doc rammed the breathing tube over the bronch, down into the lower segment. We pulled out the bronch and gave a few breaths. There was no leaking. His chest rose with each breath. His oxygen was back at 100 within 45 seconds. We got him up to the OR and about 6 hours later had fixed him up, and he survived that night. The best feeling though, is when a renowned otolaryngologist whom we called in to help with the tracheal repair asked how I got the tube down into the lower part of the trachea. I described what we had done in the ED, and he just goes, "How? That's not a thing." Story 3. A cool call I had as a paramedic many years ago immediately annoyed my partner and I, 20-something-year-old male, woke up with nausea and vomiting Sunday morning in a neighborhood that is known for young people partying. The call note said there was a small amount of blood in the vomit, so it got up triage to paramedics responding. We arrive and are met by the patient's girlfriend, who is freaked out but guides us to our patient, who is white as a sheet, drenched in sweat, vomiting all but pure blood into a trash can that is already pretty full of blood. We start our assessment and treatment, and he has a vague medical history. He has always had digestive issues, and has to eat a diet with extremely low fat. He has chronic diarrhea, and really bad hemorrhoids. We ask about what he got up to last night, and if he was partying. He says no, he can't have more than a beer under any circumstances or he's a mess for days on end. He smoked a little weed, but not more than usual, and he smoked from the same bag earlier and was fine. He has never thrown up blood before, had never done more than go to an urgent care for his issues before, as he didn't have insurance. Obviously he has an upper GI bleed, but something clicked in my caveman brain and realized exactly what was happening. His liver was screaming for help, can't digest fat, can't process alcohol, and what seemed like an innocuous comment was the key to the whole thing: his hemorrhoids. If the circulation through your liver gets backed up, it causes pressure in the blood vessels that come in and out to build up. If enough pressure builds up, the veins in your butthole balloon out, causing a hemorrhoid. If that pressure goes north, you can get esophageal varices, which are essentially the same thing as hemorrhoids, but in your throat they can rupture and bleed like an absolute son of a. Despite our efforts, he had lost a ton of blood, and rapidly got worse. Upon arrival into the critical section of the ER, he painted one of their walls, passed out, and needed to be intubated and given many blood transfusions. The attending head doc in the ER had always been an aloof dickhead who didn't play well with nurses nor EMS, but after the dude's liver labs came back and we were back later in the day with another patient, he pulled me aside to be like, "What exactly is the scope of your guys' training? That was crazy that you caught that." I reflected on that moment for the rest of my career, during which I felt like an absolute moron about 90 of the time. Story 4. Shout out to the doctor who recognized that my toddler had leukemia. She had an ear infection with a low-grade fever that her PCP had treated with antibiotics. A week later, we took her to urgent care because she still had the fever whenever Tylenol wore off. The infection was gone, but she had been developing a lot of bruises in the weeks prior. Her PCP had dismissed the bruising when I asked if it was something to worry about. Some kids just bruise a lot. But the doctor at urgent care noticed she had bruises on her back and sent us straight to the ER for a CBC. We are 9 months into treatment and doing quite well now thanks to her. Story 5. My kid was born with a rare lung disorder called congenital lobar emphysema. At the time, less than 50 cases had been seen in the world. Son shouldn't have lived past 2 weeks, but our pediatrician finally diagnosed it at age 5 months. Son had surgery, left upper lobectomy the following year. Our pediatrician was at a huge conference with around 700 MDs in attendance, and the speaker threw out the symptoms for my kid's disorder. Only 3 hands in the room raised to acknowledge they knew the diagnosis, and one was our pediatrician. Story 6. I am not a DR, but one saved my life by a simple handshake. I was in hospital with gallstones, I was prepared for surgery, saw my surgical team etc. All good, we're taking you up for surgery. I felt absolutely rubbish but put it down to anxiety and the pain from the gallstones. The DR was in the room to see the woman next to me. He was Irish and I am Irish, both outside Ireland, so we picked up on the accent and had a little chat. As you do. As he was leaving he went to shake my hand. He walked away and came back, questioning me that my hand was extremely sweaty. I explained that I have anxiety and it was going off, but he was not convinced. Thanks to him putting up an argument that my surgery should not go ahead and I need scans. My scan was cancelled 3 times but he kept on pushing it through. I was diagnosed with multiple bilateral PES. Story 7. Working out that someone's occasionally coughing up blood was linked to their menstrual cycle, then finding it was from a patch of endometriosis in the lung. Don't see that every day. Story 8. Not a doctor, but a nurse. I had a patient that had been struggling to find a medication to help with her anxiety and depression. After a couple of years of trial and error, we found a med and dosage that worked extremely well for her. Time goes by, and she suddenly starts having symptoms again. She said, I don't know what's happened. The meds were working so well, and now I feel just as bad as I did before I started medication. We spent several calls and visits going over every single thing, just grasping at straws. Has your pill manufacturer changed? Do the pills look different? Has your diet changed? Increased stress? Exercising more? Anything? Finally, I asked her if she had recently started any new medications prescribed by another practice, and she suddenly remembers I started metformin about 6 weeks ago. I think to myself, that's it. I asked her not to be gross, but are you having a lot of diarrhea since you started the metformin? She goes, yes, I'm pooping several times a day, I can't keep anything in. I then explained to her that the problem was, she wasn't absorbing her depression meds, she was pooping them out. So not only was she not getting the benefit from the meds, she had been going through med withdrawals too. She talked to the doctor who started her on the metformin, and he switched her to metformin ER, and changed the timing of when she took both meds. 2 months later, she was back to feeling good again. Story 9. Had a patient that was getting weird ulcers and was diagnosed with atypical Behçet syndrome. I realized that the ulcers were from the levamisole that was used as cutting agent in the cocaine. She quit the cocaine and the ulcers went away. She also gained about 100 pounds and became diabetic, so, Story 10. Not a huge mystery, but one that drove me nuts for 4 years as a dentist was this guy who had severe acid erosion on all his teeth, but one area in particular was super bad. I figure he had to be obsessively eating something acidic and chewing it with one side of his mouth. I would interrogate him at every single visit, and there were tons of visits because he was totally destroying his teeth to figure out what was causing it. I probably asked the guy 50 times over 4 years if he liked to eat sour candy. Always said not really. One day we had a long appointment together, and I just decided to name every sour candy I could think of while I worked. Captive audience. When I said crybabies, he was like, I like those, they're so sour. Come to find out he was eating 1 to 2 bags a day, dude. What did you think I was asking about when I asked if you liked to eat sour candy all of these years? Story 11. I'm a medical librarian. I had a surgeon call me about a patient she was completely stumped over. Head had a device installed, but it needed to be replaced. The problem was the location. If she tried to remove it he would have hemorrhaged. If she left it in place he would have died slowly. Did a bunch of research, even called the device maker and spoke to them. Finally found a tiny bit of a thread online which eventually led to a YouTube video of the exact procedure she needed, and she was able to remove the device successfully. Story 12. Not really much of a medical mystery, but many cases of endometriosis that went undiagnosed for years. I also was able to figure out that a patient's dropping hemoglobin and subcutaneous bleeding was being caused by scurvy, due to his multiple year-long commitment to a strict ketogenic diet. Story 13. Not a doctor but a genetic counselor who works in pediatric oncology. And it's less of a what could this be, and more of a trust your gut situation. I saw an infant with a brain tumor who I was originally told had no family history of cancer, but upon talking to mom actually had breast cancer in her 20s and her mother had a rare sarcoma and died in her 20s. Moreover, all of their maternal relatives had cancer at young ages. Interestingly, all genetic and tumor testing for both the infant and their mom was negative thus far. Usually, in that case, we say we don't know every cause for cancer yet and leave it at that. But the plot twist of the family history was extremely suspicious for one particular cancer predisposition syndrome, so I couldn't in good faith just end things there. I ordered a single gene test on a whole genome platform, which sequences far deeper into the gene than any other test does. Labs don't sequence that far because it's extremely rare to find anything there in the intron, which scientists used to believe was junk DNA because introns don't get translated into protein. Sure enough, test identified a mutation deep within the intron of this gene. It's absolutely the explanation for the child's brain tumor and his family history of cancer. Certainly a devastating result as this cancer syndrome is associated with a 100 lifetime risk for cancer of almost any type you can think of. It's called Li-Fermini syndrome if you're curious. However, I'm so grateful to finally have an answer for this family, because we can ultimately pursue intensive surveillance for positive relatives that will quite literally be life-saving. And of course this fuels my paranoia of is a negative, ever truly negative, and intensifies my desire to dig deeper for these kids. Story 14 Munchausen. This lady kept getting septic from weird infections that didn't make sense based on culture data. Turns out she was quite literally injecting herself with her own. Story 15 Not sure if this is a mystery, but I connected the dots as a resident, 8-year-old kid that presents to ER with fever, SOB and a small lower leg wound after falling while running 2 days before. He also wasn't wanting to walk much due to pain from his leg. Everyone had assumed his wound, but when forced to ambulate he had a bad limp. I was in last year of MedPed's residency. I presented the patient as fever from a septic hip 22 from his leg wound, shortness of breath and fever from pulmonary embolism also. This was my guess before labs and CT based on physical exam. In the end I was right about everything. I was just trying to be a smartass because I had a good relationship with the attending and PE in kids is way less common than adults, so I thought I would be more obnoxious throwing in the PE part. It was humbling because I was just being obnoxious and it made me think about what I've missed before not turning over rocks. Similar situation years later with an elderly woman with anemia, GI bleeds and aortic stenosis that my partner ran by me. She had been scoped by GI and been to heme with negative anemia workup. Cards didn't think she warranted valve replacement. Patient kept getting passed and my partner was getting frustrated. Being as I asked if anyone had considered Hayes syndrome, I told him put that in your note and send her back to cards. She underwent valve replacement. No more bleeding, no more anemia. Story 16 Patient seen 5 or 6 times in our office as well as her OB/GYN for vaginal swelling, pain, redness with workup for the typical culprits like yeast, BV, STDs, trick, etc. all negative and no response to empiric treatments. Spent about 20 minutes going through her whole history including new underwear, brands of pantyliners, detergents, douching, etc. Finally managed to figure out that she started using scented toilet paper, and all of her issues resolved as soon as she stopped. Story 17 I work in dermatology. I had a patient who was experiencing delusions of parasitosis. They literally think they have bugs crawling on their skin. It's a somewhat common psychological disease we experience in dermatology and most of the time, it is 100% psychiatric in nature. Patient reports that he swears that he got the bugs from a partner. Physical exam on the genital area shows no abnormalities and he has no skin abnormalities, so I run an STD panel. Long story short, he has neurosyphilis and I had to send him to the hospital infectious disease for some heavy doses of penicillin. Syphilis definitely has the reputation for being the great imitator. Story 18 Not me, but my attending. We had an older guy with new severe hip pain but his X-ray and MRI was normal. Things were just off and she felt like there was more going on. We got an MRI of his spine and lo and behold he had a huge honking spinal abscess. Most of the time you would expect to see weakness or sensory changes with a spinal abscess. He had none of that. We imaged his whole spine and found a couple more spots of infection. So we imaged his brain, big old abscess. We also got a heart ultrasound echo that ended up showing a massive infection sitting on one of his heart valves. He had literally zero symptoms except the sudden onset hip pain. Long story short, we think his bad diverticulitis let some bacteria into his blood and he was unlucky enough to have it seed his heart valve. He ended up doing great with a truckload of antibiotics. Story 19 Not a doctor but giving kudos to my daughter's doctor. At age 5 she had a tummy ache that seemed more than normal, so we took her to urgent care. They sent her home and thought it was a rough stomach bug. She wakes up the next morning and doesn't want to move. From the time I could feel her kick until she came out, she was constantly on the go, so we took her to ER. Doctor tested her on heel drop test suspecting appendicitis. But she passed, so he said he wanted to run a blood test because he had a suspicion but was unusual. Blood test comes back, her pancreatic enzymes I think were off the charts, which is what doctor had suspected pancreatitis. She spent 5 days in one of the best children's hospitals in Colorado, no underlying cause, which is extremely rare for a child. 2 to 10 cases per 100,000 children, and made a full recovery. How that doctor suspected it, I have no clue, but very grateful for them. On a side note, she was transferred to the Children's Hospital main campus, which is also a teaching hospital, and it was fascinating to see the process. Because it was such an unusual case, we had anywhere from 3 to 5 residents come in each morning learning about her, asking the head doctor questions, etc. Our last day the department head came in to talk to us about how unusual her case was, that we would likely never find a cause and how difficult that may be going forward, but such is life sometimes. She is now 12 going on 18 as it seems, and hasn't had a problem since. Story 20 Nothing seemed to help this patient. She really had no significant diagnosis, and she was on over 30 prescriptions, meds for side effects of her other meds. I've eliminated about 12 so far. She's feeling better but is anxious about reducing further. Clearly her previous provider was just writing for whatever her complaint of the day was. And never stopped anything. Story 21 I'm the patient here and I have a few rare diagnoses, but I'll tell you the one with the more interesting story. See if you can guess the diagnosis before the end. It's an atypical presentation. At around 19, I began getting a lot of UTIs. Months later I realized that I can't feel when my bladder is full. I go to a urogynecologist and do urodynamics testing that confirms the nerves to my bladder are indeed dead. I have a slight herniated disc, so it gets attributed to that. I develop really bad sciatica and my feet would go numb. I wind up in pain every day with significant muscle spasms in my lower back and down my legs. which is typical for a herniated disc. One neurosurgeon wanted to operate, but when I got a second opinion he explained that my herniation shouldn't be causing these symptoms because it's very slight. I get referred to PT, but PT seems to worsen my symptoms. They told me they could no longer help me and discharged me as a patient. Years go by, my pain and numbness only worsen. Finally the pain spreads to my abdomen and reaches a point where I am bedbound almost all of the time. I just so happened to be seeing a reproductive endocrinologist for fertility issues at the time, and they just so happened to have one of the best endometriosis specialists on the East Coast on staff. She recommended a laparoscopy on a hunch, and she was right. We operate and there was scar tissue everywhere. I wake up with no more sciatica or muscle spasms or pain. That surgery completely changed my life. I had never had bad periods. I barely even cramped. I had sciatic endometriosis primarily, and if I wasn't seeing that exact reproductive endocrinologist, I may never have had it treated. Story 22. Not a doctor, but when I was working in ED as a nurse, I got a transfer from a smaller community hospital in our system. Guy was one of our cancer patients and had presented there with chest pain, and since their workup was negative they sent him over thinking it must be treatment related. So I go in and start my assessment, open up his gown to do a 12 lead and I'm like, sir, how long have you had this rash? I scoured the notes he was sent over with and there was absolutely no mention of a rash even though they did an EKG there as well. I found the EDMD, who was a notorious hard super unfriendly, and asked if he'd seen the patient yet, which he hadn't, and I told him, well, I think he's got shingles. He went in, checked him out, wrote a script and off he went. Story 23. Not a doctor, but my psychology degrees came in handy when a family member was discussing his brother's memory issues featuring confabulation, and I correctly suggested Korsakoff syndrome, similar symptoms to Alzheimer's, but most commonly found in alcoholics. Which he was. I also saw various doctors about abdominal issues and got diagnosed incorrectly with various digestive disorders and medicated accordingly. I figured out on my own that it was gallstones, got an ultrasound privately, and finally forced my doctor to refer me to a surgeon. Story 24. Not a doctor but social worker. We can't diagnose, but we can make recommendations to clients' patients that they be evaluated for XYZ diagnosis, especially in mental health. During the pandemic I was doing brief intervention and general mental health services. A client was describing some really intense emotional reactions to certain sounds they encounter in their daily life, and that it was really challenging for them. The way the client was describing the reactions sounded to me like neurophysiological disorder, and not generalized anxiety or depression, but that's what they'd been diagnosed with. The client's doctor had been prescribing Ativan for years, but there had been no improvement in their reactions to these specific sounds. Google the client symptoms and misophonia was the first hit. I read the descriptions and it fit exactly what they'd been describing. I had never heard of it but read a couple of journal articles about diagnosis and treatment and was convinced that I had to send the client some information and provide a referral to a specialist clinic in their area. This was all within about 2 hours of the initial consult. They wrote me back to say thanks and that they would check it out. Next video call was several weeks later. The client tells me that they went to the specialist and got a diagnosis of severe misophonia. They said that the clinic was very responsive and supportive and that they were getting treatment, which is mainly CBT anyway. They thanked me for validating their experience. I always felt great about that one, and it was such a simple effort on my end. Story 25. Diagnosed lupus cerebritis in a patient who was basically comatose after being on ECT for depression for a couple of years. I think she still had some underlying psych issues, but improved significantly after starting high-dose steroids. I was consulted as a resident on the ID service and noted the patient had persistent proteinuria and had been seen repeatedly for joint pains. My attending said we should sign off after the lumbar puncture was negative for infection, but I convinced him to let me order lupus labs before we signed off. Story 26. This young person comes into the ER in an ambulance, passed out. They are septic fever, hypotension, tachycardia, and they are losing 2 organ systems at the time of presentation, kidneys and liver. They can't give a history because they are obtunded. They send this person to me and of course don't help me with 4 contrast because they don't have sufficient renal function. The images come out looking like vague gray mush edema everywhere. I see 1 to 2 millimeters gas bubbles, 1 in the portal vein, 1 in a tributary of the superior mesenteric vein and 2 next to the pubic symphysis. These gas bubbles do not belong there and are a grim prognosticator. I have to make some kind of wild guess because this person is close to death. I look closer and see erosions on the left pubic body. I call the surgeon and tell him to cut out the pubic symphysis septic arthritis. I make the diagnosis in 20 minutes. They cut out the offending joint, and the patient walked out of the hospital 7 days later. Follow-up CT showed hundreds of liver abscesses from bacteremia, those cleared with continued antibiotics. My coworker who read the follow-up CT came up to me and congratulated me on a brilliant diagnosis. Story 27. Cardiac amyloidosis from 3 EKGs 9 months apart and an increased frequency of ER presentations for shortness of breath. Echo confirmed speckled myocardium. 2. Scleroderma renal crisis in 84 years old, not previously diagnosed with scleroderma, transferred to me out of ICU after 5 days with uncontrolled BP and acute kidney failure. Story 28. Obligatory. Not a doctor, but my daughter was medevaced by helicopter to the nearest PICU at 5 weeks old for hypothermia and suspected sepsis. Even on antibiotics she was getting worse. Full body MRI and CTs showed nothing wrong, blood work coming back fine. vitals appeared to be fine but she was becoming paralyzed and couldn't eat. She had to be placed on a ventilator. Genetic testing came back negative for Prader-Willi, Angelman and some others. Someone on her team suspected infant botulism and ran a fecal sample and sent it to the CDC. They had baby big botulism immunoglobulin flown in from California and then driven 2 hours to get to us, and once she received it she started showing improvement. She ended up having type BA infant botulism, the only case diagnosed that entire year in the United States, and she was only the 13th case of infant botulism in Minnesota ever. Without baby big, botulism is upwards of 85 fatal, but with the antitoxin children typically have 100 recovery with no lasting side effects. Story 29 Local street guy presenting per EMS with medics eye rolling worst fake seizures I've ever seen, handed off to me 1 hour after ED arrival. Prior team was frustrated he wouldn't answer questions. Couldn't get in 4 or blood, insisting patient was being difficult, uncooperative, AMS. HR sustained over 130 in young man for over an hour, moderate elevated BP, but that peripheral cyanosis had me at hello, that ain't right and this don't make sense means it's rectal temp time 108, 0 highest possible reading, malignant hyperthermia from recreational pharmaceuticals was layer determined, intubated, initiated rapid cooling measures. Saw the patient 3 months later 10 degrees cooler, looking none the worse for wear. Story 30 Not an MD but a PhD, I had a young black male come in for depression. His parents and family told him he was lazy and unmotivated, told him to get over his depression. It's not very common for young black men to come to therapy. He met 5 of the 8 symptoms of depression and I asked him about his eating habits. This led me to digging in more about his diet. Turns out he had celiac disease. He changed his diet and voila, depression disappeared. Story 31 My dad is a veterinarian. He had a client come in with a cat and mention the client was going to have exploratory surgery the following week due to some swollen lymph nodes. My dad asked him if his doctor had ever tested him for or mentioned lymphurticulosis, or cat scratch fever. Next thing my dad tells me he receives a letter from the surgeon commending on saving this man from an unneeded surgery. Story 32 Psychiatrist here. In residency I was moonlighting at a standalone psych ER. A man who didn't speak English was brought in by emergency services for psychosis. With some interpreter help, we were able to identify he was from Bhutan and that he had been a freedom fighter. But the interpreter said that he spoke very little that was comprehensible. I noticed some tattoos that seemed amateur and possibly from his time in combat. It dawned on me he could have hepatic encephalopathy from Hep C. I arranged transfer to a medical ER. They were pretty upset with me about it. To their credit, they called back later that night to confirm I was correct, leading to a plan of appropriate medical care instead of inappropriate psychiatric care. Story 33 I'm not a doctor but I figured out my own medical mystery that they couldn't figure out. After multiple visits to the ER, unfortunately it was a parasitic situation. I'll leave it at that to spare you all. Story 34 NAD, but saw this, patient came with constant hiccuping that wouldn't go away and dizziness spells. Initially they were told it was just hiccups and should go away, but it didn't, and it was constant. Their primary care and urgent care physicians kinda blew them off and racked it up to nothing. They wound up going to the emergency room who did a chest x-ray to rule out some kind of weird origin. So anyways, this patient had a permanent pacemaker placed some months ago. Chest x-ray showed the wire that goes into the heart to pace them had punctured the heart, gone outside of it, and looped its way around to the other side and was sitting partially against the vagus nerve. Their constant hiccups were from their dislodged pacemaker causing pulsations to the nerve that controls their heart rate and breathing. They wound up having the troubled lead wire removed and replaced, and their hiccups and dizziness were fixed. Story 35 My doctor figured out that my recurring episodes with defecating alarming amounts of blood was due to endometriosis in my colon. I had my uterus taken out due to cancer, so we had no way of knowing that each month I was menstruating sans uterus from my colon. Yes, it was very painful. Story 36 I actually just figured one out. I've never been allergic to anything, never had eczema, no notable issues or problems skin-wise. That was until the end of December this last year. I started getting really dry patches on my eyelids that slowly got worse to fully red, swollen and flaky skin that had also spread around the edges of my face. It was so painful and I had no idea what it was. Finally got into a dermatologist and she gave me some cream because she immediately clocked it as contact dermatitis caused by an allergic reaction. The cream helped but whenever I stopped using it, it came back, so I went in and she told me I had to do a patch test. To make a long story shorter, my insurance me and I couldn't get it then so I had to get it sorted and then wait so long to get into another office just to get a patch test. Anyways, I finally got the patch test. The result was, I am incredibly allergic to nickel. Honestly I wasn't too surprised because while I didn't think was allergic to it, I knew I was at least sensitive so my jewelry is nickel-free, but my glasses aren't this whole time. The reaction has been from my glasses and it's crazy to me. Story 37 Not a doctor but actually a psychologist who made a life-changing diagnosis for the patient. This patient, a female of 67 years comes into my practice one day after her physician refers her to me about having anxiety alongside vertigo that has lasted for over 12 years. The doctors couldn't figure it out so they thought it was psychosomatic. After a brief interview she tells me her symptoms had improved while she visited her sister for a week and immediately got them all back when she returned to her house. I then ask her about who lives with her and tells me she lives with her son. her son's wife and their cat, right there, and there. I think this isn't anxiety but allergies. I then suggested she try moving the cat out of the house for a couple of weeks and do a deep cleaning of the house. She returns a month later telling how she no longer feels tired all the time. Her symptoms have completely disappeared and no longer suffers from vertigo. She managed to get off her meds that she took for 12 years. All because of a cat. Gotta be honest, I felt like house that thing right there. Might not be this huge medical mystery, but seeing her face after she had improved dramatically, her quality of life was worth it. TLDR lady came in suffering from vertigo and anxiety. Turns out she was just allergic to her cat for 12 years, and no one noticed until I made the connection. Story 38. I had a patient once come in with tinnitus and on a hunch decided to check an aspirin level. It was sky high and we got her into emergent dialysis. Super lucky catch. Story 39. Nurse here. I learned a really terrible way that herpes can potentially be cured. Edit due to multiple requests. Here is the method. HSV hides in your myelin sheath within the peripheral nervous system. There is a complication from getting a disease called Guillain-Barré syndrome. This causes demyelination of the peripheral nervous system. There's about a 15% risk of mortality as it can shut down your respiratory drive. This is a temporary complication that resolves on its own. Anyways, if someone were to develop a severe case of this, and they were HSV positive, for a period of time the HSV would have nowhere to hide, and something like acyclovir could completely eradicate it. So if you were to induce the syndrome, and then administer heavy antivirals after the syndrome had demyelinated the affected nerve roots, you would completely destroy HSV. This would be a nightmare of a recovery. But there you go. Story 40. I was the first to diagnose a patient with Huntington's, which is a rare neurological order that is honestly really devastating. I spotted the choeric movements, which is medical speak for involuntary dance-like movements. He presented with suicide, which is very common, but he is doing well now, all things considered. I've been a resident physician for less than a year. In turn, for context. Story 41. Not the doc, but I was taking care of a patient that was hospitalized for multiple days because of crazy swings in her blood glucose. The docs couldn't figure out why 1 minute she'd be cruising well over 350 and climbing, and 20 minutes later it would crash into the 40s. She was nothing by mouth for reasons I don't recall, possibly a gastroinfection, so we were pumping for dextrose multiple times a shift to keep her alive. We were literally down to our last vial, including robbing the crash cart on my unit and the ER, and I was freaking out because I was working alone that night. It was a rinky-dink rural outpost hospital. One doc in the ER on call is needed for my unit. Overnight, no real support besides calling EMS to transport to a larger hospital over an hour away, and I was afraid of losing my patient. In between this patient's crises and other patient care, I did a deep dive on the interwebs and found a research paper that discussed how some diabetics respond that way to certain classes of antibiotics. I let the hospitalist know in the AM and provided the link to the paper, but never got a response. I was off the next night, and the patient was gone when I came back for my next shift. I was afraid she died, but was informed by the outgoing shift that she discharged home because our hospitalist figured out it was the antibiotic causing the chaos and switched meds, and immediately her blood glucose stabilized, and with a new antibiotic the infection was brought under control.